right, so I'm going to go ahead and determine the need for trach care. I want to go ahead and go ahead and check his charts. It can be done in independent nursing action every 8 hours or at least every shift. For new trach, I want to go ahead and enter the room 30 minutes prior. Hello, my name's Heather. I'm going to be your student nurse today. I want to go ahead and check his patient chart with his armband. And we're going to go ahead and verify your name, date of birth, and medical record number. And do you have any allergies, Mr. Hicks?
No, ma'am.
Alright. And are you experiencing any pain today?
Yes, ma'am.
On a scale of 0 to 10, 0 being no pain, 10 being the worst, how would you rate your pain?
5, ma'am.
Alright. So I have some pain meds here in your chart. I'm going to go ahead and administer. And I want to go ahead and document that I gave him his pain meds, and I want to come back in 30 minutes. So now 30 minutes has gone by. I'm going to come back in. Hello, I'm back. Do you mind if I go ahead and check your name, date of birth, and medical record number? Alright, and any allergies?
No, ma'am.
I know this gets a little repetitive sometimes, but do you, what's your pain after some pain meds?
0.
0? Well, that's good. So I'm going to go ahead and clean your inner cannula for your trach, and it shouldn't take much long. And you won't experience much discomfort, but we'll get through this together. So I want to go ahead and don my PPE. And I want to go ahead and lay the drape over him. And when I came in the room, I washed my hands each time. And I want to go ahead and open my trach kit here. We'll go ahead and pull out my sterile gloves and my sterile field, making sure I'm touching the shiny side. And I'm making sure I'm maintaining the 1-inch sterile field border and laying my sterile field down. And now I'm very carefully make sure my flap is tucked here, and I want to quickly dump the contents of the trach kit onto the sterile field. And I have my normal saline here. I want to go ahead and fill this container. And I'm going to go ahead and put my peroxide. This container is going to have a half and half solution. I'm actually not putting it in there due to our hydrogen peroxide is very low today. And now I want to go ahead and put my clean gloves on. So now I'm going to go ahead and take his trach collar off. And I want to go ahead and remove his inner cannula, and I'm going to have to rotate it counterclockwise and pull out. And I want to go ahead and put this in the half and half solution. And then I want to go ahead and give him his oxygen back. And now I can go ahead and remove my clean gloves. Now I'm going to go ahead and don my sterile gloves. want to go ahead. That would actually not happen in real life. Separating some of my supplies here to set myself up for later. And I'm going to go ahead and take my inner cannula, and I'm going to take my brush here and go the outside. I'm going to keep it low, and I want to make sure I scrub. And then I'm going to go ahead and wash the outside of it as well. I would not cross my sterile field because that is contaminating it. And I'm going to go ahead and drop this into a normal saline solution. And then go ahead and pick this up like a hot dog. And I'm going to run through my pipe cleaner through it once, twice. Now I just touched the clear part, and I can go ahead and reinsert this. I'm going to go ahead and remove this. Now this hand is no longer sterile. And I'm going to go ahead and rotate it from the 9 o'clock to the 6 o'clock position and locked in. Now I'm going to go ahead and remove the drape here, throw it out. But before I throw it out, I'm going to go ahead and notice the coca on it, the color, the odor, the amount, and the consistency for documenting later. And now I want to go ahead, dip my Q-tips in. And I'm going to want to clean the outer faceplate on each side. And then I want to go ahead and go from the inner to the outer, cleaning the skin below. And then with my dry gauze here, with each corner, I'm going to go ahead and use each corner to dry the underneath the faceplate. And now I can go ahead and put the new gauze on. And I can replace the tie. So I'm not going to take the old tie off first. I'm going to go ahead very relaxing for my patient. He fell asleep again. And I tied this one first. I want to make sure that I can put at least 2 fingers under here and that the tie is not over his carotid. Now I can go ahead and untie the old tie, remove out, make sure I gave him his oxygen back, and remove his drape. Go ahead and remove my gloves that are very torn because my hands are sweaty. And I want to go ahead and wash my hands. I'm going to want to go ahead and reassess his lung sounds. And I would not do this over clothing. And I want to reassess in 6 to 8 places anteriorly and posteriorly. And then I'm going to go ahead and get a full set of vital signs and assess his skin. I want to make sure I assess his skin to make sure that he is getting proper oxygenation. And then I'm going to go ahead and lower the bed in the lowest position, make sure that it is locked, call bell in reach, and the side rail is back up. And I want to make sure I do hand hygiene, and now I'm going to document. Now I'm going to document that I did a pre and post respiratory assessment. I noted the coca on the gauze, that I of the secretions on it, that I went ahead and cleaned his inner cannula, and I want to make sure that I document that I assessed his skin and his vital signs.